Hey, good evening, everyone. So I decided I'm gonna make a video. I just had a voice crack. There we go. That's a great way to start the video. I'm gonna make a video. It's probably 12:20 right now. It's midnight. I want to talk real quick about pre-operation and things that are gonna happen probably within 2 weeks before your surgery. And that is going to be, you're going to have an appointment with your doctor, just kind of making sure that you're going to be good to go into surgery, get your blood checked, and there's a vaccine that you're going to have to get, and I'll talk about that all in the video. So my surgery is, well, right now it's Sunday because it's midnight, so basically tomorrow at 10:50 in the morning, and I have to be there at 8:50, and it's at Georgetown Hospital in DC. I'm a little bit anxious because obviously it's a life-changing experience. It's a life-changing thing that's going to happen, and I've never been into surgery before, so all new to me. I am very, very curious to see what it'll be like, because I've heard for people it sounds like robots when you first get turned on. But to clear something up real quick, I'm not getting it turned on on Monday. I'm getting it turned on. Activation is 10 days after I get the surgery done, and that's on one side at a time. So for your pre-operation appointment, you'll visit, if you are under 18, I'm assuming a pediatrician. If not, you'll just visit the doctor that you usually go to, and you're gonna get your blood work done, blood checked. I don't know if some doctors' offices might do it right there, or you have to go to a bigger hospital. Get your blood work done and make sure, I think they're going to check for clotting or something like that. They're going to check your vitals, and I think usually all that will go smoothly. That's nothing you really have to worry about. Next thing is you have to get a vaccine, and I understand some people don't like that, but it's only one vaccine, something you just got to do. It's called a pneumococcal vaccine, and what that does is it'll prevent you from getting, I believe it's meningitis in your brain, which is the result of going into surgery and doing surgery on your head. I guess you're at a much higher risk. I know newborns, or maybe babies that are a couple months old, they get that vaccine. So most people will already have it going into this, but this is just kind of like a boost to get it now, I guess. Some things that I'm going to have to start doing is, since it is Sunday, midnight today, I can no longer eat or drink water, so I'm going to have to drink a lot. What I'm going to do is I'll probably go pick up a gallon and make sure I have that gallon down of water, just to make sure I have enough water going into my system so that I'm okay for the morning. And I can't eat either, so, kind of making sure you have enough food, eat healthy before your surgery, make sure you're good to go. Another thing, and this will apply only to some people, but it's no medicine. You can't take any medicine, I believe. For me, it was starting kind of a couple days ago. So about, I'd say, half a week to a week before surgery. No medicine except for things, I think it's called topicals. So if you ever heard of vapor rub, if you have a cold, it's like a minty paste that you can put under your nose or on your chest, and it kind of helps you get through congestion. It kind of like numbs the congestion, so you feel like you're breathing normal again. And that's just a topical. It's not something you take or swallow. So I'm assuming you can still take that, but everything else is a no-go. And that is basically everything in terms of pre-op that I can think of right now. If I'm missing anything, either I'll make another video, because my parents will watch this and they'll see I'm missing something, or someone in the comments will say, hey, what about this? And I'll just address that in maybe a quick video. But now I'd like to really quick go on to how I'm feeling about it, because obviously it is tomorrow at this point. Just over, that's like 34 hours away, surgery, which is not a lot of time. And honestly, I do feel a little bit, sorry about that. I do feel a little bit anxious because I've never been into surgery before. It's my first time going into surgery. But I know that this is going to be really good for me, and I'm comfortable with the fact that I have to go into this surgery. And I trust the team that's going to be doing this surgery 110%. They're I mean, I've been at appointments with them multiple times, and I know that no matter what happens, this should go successful. And what I mean by that is it's 50-50 whether I retain or lose residual hearing. Um, I don't know how much that would impact me. I won't really know until it happens. If I lose residual hearing, I don't know how I'll react. I'm used to not hearing much, but I don't know how much of a blow that will be to me if I lose it. Obviously, you hope for the best and that I keep some residual hearing. Um, I think I'll try to document as much as I can because I've seen my goal coming onto this, coming to YouTube and making a channel was that I could support people that are going to be going into surgery for a cochlear implant or people that have a hearing loss and wear hearing aids and kind of be like a mentor or counselor or like, someone that can help people get through it or provide information about it. And so people know what to expect going into it. Obviously, I'm very young, so I don't have like life experience with it. But my case is kind of uncommon because not a lot of teens at my age are going into it at 17 years old getting a CI. It's either mostly newborns or older people. So I'm at a weird part of that spectrum. So I think it'd be good if there's other teens out there to be able to provide information to them. So I think that's all I have for today. If you have any questions, of course, leave them in the comments. I am going to head to bed because it is way too late, especially because of surgery tomorrow. But I am anxious, so I wanted to make this video, and that's my honest thing right there. I am anxious, and I think everyone should be, and that's something you can expect. But just know that you have a big support group with you. You have your doctors with you, your parents with you, your friends and family, and these surgeries people have been conducting these surgeries for a long time, and technology is only getting better. So what I can say is that you're allowed to be anxious, but just know that if you're going into it, your surgery is gonna go well, and you're gonna be able to hear again, and that is, improving your quality of life, which is very important. So that's all for me. Have a good evening, and I'll see you in the next one.